Hi, welcome to Sullivan Dermatology. I want to talk about a syndrome or a condition that's a little controversial in the world of dermatology and a great new article I read. So this is steroid withdrawal syndrome. So this is where once somebody's been using steroids for some period of time and they stop using them, their symptoms come back with a vengeance. And for a long time, patients have been saying something unusual, something different is going on when this happens. And many dermatologists have just assumed, well, you've been using these steroids for a reason, and when you stop using them, things come back with a vengeance. So there's this really great paper where a physician who listened to patient advocacy groups looked into this syndrome, and he found something really interesting. The first is that what patients are describing is very different than their original symptoms. You know, we all can imagine what eczema looks like. It's red and scaly and itchy, and dermatologists know that it occurs in certain locations. But what these patients were describing was disease that was different than their original eczema. So it's different for a few reasons. One, it looked different. So instead of involving the bends in the elbows and the knees, the elbows and the knees on the other surface have thick elephant-like skin. These patients also describe having red skin descend from their shoulders down to their hands, which is unusual for atopic dermatitis. And then really importantly, these patients describe something they call zingers. This was zapping or a tingling or a sharp pain. And that's not really something that we see with eczema or atopic dermatitis. These patients also describe having something like hot flashes, so a flushing or a thermo-dysregulation. Again, not something we see in atopic dermatitis. So these researchers looked to see what was going on. And interestingly, they found that in patients who had this syndrome, who were describing these symptoms, they had a dysregulation of their mitochondria. So if you remember from way back when you took science, mitochondria are the little energy workhorses in your cell. These are little organelles or little things in the cell that power the cell. And what they found is that when people were using topical steroids, especially high-potency topical steroids for a long period of time, they were much more likely to get a dysregulation of their mitochondria. And this dysregulation caused a breakdown of the system for producing energy that then created toxic metabolites. And these toxic metabolites, they think, are responsible for this hot flashes, for the zingers. So who develops steroid withdrawal syndrome? It's not everybody. So when the authors looked at this, it was almost never found in anybody who used steroids for less than 2 to 3 weeks. So, often we'll prescribe steroids for a few weeks, and that's really how long you want to use it. If it's beyond that period, we want to talk about other things. It was mainly in patients who had used steroids for months and months, maybe even years, and especially in patients who use high-potency steroids. That's one really important take-home, I think, from this, is that if you come see me or another dermatologist, you don't need to be afraid of using topical steroids. You just need to be cautious about how long you use it. So what happens to these patients? When they look at it, it's really broken down into fours. About 25%, once the steroids are withdrawn, their symptoms come but go away quickly. Another 25%, they go away in under 6 months. 25%, it can take longer, months, over 6 months to years. And there are about 25% who have some persistent symptoms. The article does discuss some possible treatments. We can talk about that in a later podcast. I think the really take-home message here is that two things. What patients were saying about steroid withdrawal syndrome was true. They were describing things that were really different than the average. And then the other take-home is that you don't need to be afraid to use topical steroids when they're used appropriately.